Improving America's healthcare system is an issue that affects all Americans, and one that is often the subject of heated national debate. One thing that is generally agreed upon is that all Americans have a right to easily accessible quality medical care. This is of particular importance to rural Americans who face unique challenges to obtaining medical treatment. Deaconess Medical Center, located in Billings, Montana, is committed to improving the healthcare services available to rural citizens. Founded in 1927 by the Methodist Church, Deaconess Medical Center has evolved from a small 58-bed hospital into a modern regional healthcare facility, serving not only eastern Montana but also parts of Wyoming and the Dakotas. Deaconess Medical Center continues to grow and succeed by responding to the changing needs of the community.
The success at Deaconess has been a result of a symbiotic type of relationship between the physician leadership in the community and the hospital. Together we have made technical advances and service growth that are very unusual for a rural medical center.
Deaconess Medical Center dispels the notion that comprehensive quality medical care can only be found in large urban areas. Utilizing the latest high-tech medical equipment, the professional staff at Deaconess provide a full range of medical services and specialties.
Deaconess has been strong and in a leadership position in cardiovascular surgery, neurological care, trauma, renal dialysis, oncology, and psychiatry.
Deaconess Medical Center supports the delivery of quality health care services to rural areas by maintaining a variety of outreach programs. Offering a communication service that includes a toll-free telephone line, Deaconess is able to put rural physicians in contact with a variety of medical specialists.
We also make available through outreach remote diagnostic services, so those hospitals or physicians who wouldn't necessarily have the capability to offer diagnostic tests such as EEGs or Holter monitors have those services available to them.
Deaconess provides rural health care professionals numerous opportunities to continue their medical and nursing education and offers expert consultation on ways to improve rural medical care. One critical area in which Deaconess has particularly excelled is in the area of trauma care. Meeting the rigid standards set by the American College of Surgeons for the care of injured patients, Deaconess has recently achieved verification as a Level 2 trauma center. With Montana's high incidence of trauma, approximately 25% higher than the national average, and a vast geographic area combined with a relatively small patient population, providing trauma care to these patients presents a special set of problems.
The trauma care provided in this state then becomes more difficult because of the distances and times involved from delivering a patient from the scene of the accident to a center where the definitive care can be performed.
D-Care, an air and ground transport service, is one of the solutions Deaconess offers for this problem. Yet D-Care is more than just a rapid method of transporting critically injured patients.
The D-Care's transport service is staffed by registered nurses and paramedics, and we have constant contact with the emergency room physicians that provide us with input on how to take care of patients in flight.
Both the D-Care Advanced Life Support Air and Ground Ambulance Services are equipped with the latest emergency medical technology, creating an intensive care environment for the critically injured patient. Once a patient arrives in the emergency department at Deaconess, preparation and cooperation among the various disciplines contributes to increasing the patient's chance of survival.
Care of the seriously injured, multi-injured patient is ideally suited to the team approach. They talk about the golden hour in trauma, and that's the first hour in trauma when many patients die. So if we have a team waiting in the emergency department before the patient gets there, we can identify their injuries and intervene in them quickly, hopefully to save that patient's life.
Working with other trauma experts, Deaconess is helping to create an inclusive, statewide trauma system.
Through the efforts of Dr. Charles Rinker and Dr. Stu Reynolds, both practicing surgeons in our state, and their involvement with the American College of Surgeons, we are planning to implement a statewide trauma system. We think that this system, by networking all hospitals and care institutions that want to participate, will bring down the death rate and the injury severity rate because of improved trauma care through this system.
Sharing its expertise, professional staff, and state-of-the-art technology, Deaconess Medical Center continues to actively respond to the needs of the region, dedicated to improving the quality of rural health care in America.